Good day, everyone. Welcome to my YouTube channel. This is my first ever video on this channel, IMG Support Australia. Thanks for the guys who have already subscribed the channel. And I think I'm going to produce some useful content for you guys, the people who might planning to migrate to Australia and come and work here. So first of all, today I will be sort of discussing about AMC process, which is the process an IMG or international medical graduate should follow to come and work in Australia. First of all, who is an IMG? IMG is an international medical graduate, a medical graduate who's graduated from a medical school other than Australia. So any person who's graduated from a Sri Lankan university or Indian university or Pakistani university, any other country, they all are known here as IMGs. I myself an IMG in Australia. So any IMG, any international graduate, when they wanted to come and work in Australia, they have to go through what we call AMC process or AMC pathway. What is AMC pathway? That's the topic for my video today. So I'm going to just discuss the AMC pathway. AMC pathway involved, first thing is the Australian Medical Council or AMC recognizing your degree or verifying your degree. For that purpose, they have what we call primary source verification. That is done with a different organization based in USA. But when an international medical graduate first sort of go into the AMC website, they will find this out that they have to do this primary source verification. Before even doing that primary source verification, you have to do what we call create a AMC portfolio. So once you've done primary source verification and AMC portfolio, then you have to go through the AMC exam process. AMC exam process involves two exams. One is the AMC Part 1 exam or MCQ exam that has 150 MCQs. Nowadays it was 300 MCQs. Now it has shortened to 150 MCQs. Out of those 150, there are that 150 MCQs actually covers medicine, surgery. I think medicine about 30% of the questions, and surgery is 20% of the questions. Then rest of the 50% is divided into like ONG, obs and gynae, pediatrics, population health, and and then psychiatry. So you got psychiatry, pediatrics, ONG, and population health, or Sri Lanka, we call it community health or community medicine. Those four areas will be covered by 50% of the questions, and rest of the 50% is by medical and surgical questions. So it's mainly medicine and surgery, but rest of the 50% is equally shared by psychiatry, population health, pediatrics, and ONG. Then the AMC Part 1 exams, when you get ready for the AMC Part 1 exam, so you have to prepare for these type of subjects. And then there are two books, two AMC MCQ books, which you can find in the AMC website. I'll put some links under this video. How I remember those books are, one is the one's cover is light blue, the other one, that's the new MCQ book. And then there was an old MCQ book, which is with a purple cover. So those MCQ books, if I remember correct, they have about 500 to 600 questions. So there's some MCQs in those two books. So you have to study those MCQ books to do the AMC Part 1. Other than these MCQ books, I suggest you to study, studying few like common X-rays, for instance, which will be covered in medicine and surgery. Common X-rays, when I say pneumonia, pleural effusion, heart failure, pneumothorax, something like so common, like clinical presentations. And then also please study some common ECG scenarios. If you want to find some sources to do these studies, I would suggest there is a, like, in Australia, there's so many websites you can go into and find like resources. So you can study, like, I think there is a radiology website based in Western Australia, Ortho Info or Ortho Bullet. Ortho Info, Ortho Bullet. Those two websites actually give you a lot of orthopedic content. You can also use the RCH website or Royal Children's Hospital website. In the fracture section, you can study a lot of, you can find a lot of study material regarding fracture and fracture management. So I suggest you to cover those areas for the X-ray side. You could obviously study few CTs and things, brain CTs, different types of hemorrhages and different types of brain pathology if you want to cover. So study some radiology and study some MCQs, and then study those two books. And from my experience, I did my MC part some time ago, but I have studied a lot of study material around the MCQ books. Like when you go through one MCQ, you can read around that MCQ and then study more things. People use the book of John Murtha, the general practice book, where you can find a lot of details related to those exams. So we got AMC Part 1. I told you briefly how to sort of navigate through AMC Part 1, practicing, and how many questions involved and what are the subjects involved. So if you pass the AMC Part 1, then you can do the AMC Part 2 exam or the clinical exam or OSCE exam. International medical graduates, when they come into Australia, they could take 3 different pathways. So these 2 exams will be different into those pathways. We'll go into those. First one is standard pathway. I just started talking about the standard pathway. In the standard pathway for IMGs, we do face the MCQ exam, and then we do face the MC clinical exam. Some of the doctors who don't like to do the MC clinical exam, they can do what we call the workplace-based assessment or WBA program, which is a program given by a lot of hospitals, not every hospital in Australia, but many hospitals in Tasmania, Western Australia, Victoria, a few, and Queensland, everywhere, South Australia, everywhere you can find hospitals which sort of give the candidate to do a workplace-based assessment, give the opportunity to do WBA. So if you find such hospital, you can do the WBA pathway. Otherwise, you have to do the AMC Part 2, the clinical exam, and you have to get through AMC Part 2 to get the full AMC certificate or eligibility to get the full registration with Australian Medical Board, which we recognize as APRA, AHPRA. I will put some links about this APRA and AMC and different parts of exams and those orthopedic websites, and then the RCH website too. So if I go back to the exam pathways, so you do AMC exam 1, part 1, and then you do part 2 or workplace-based assessment, and then you get the full registration. To get the full registration, you have to have the AMC certificate. So AMC certificate is given to IMGs who have done AMC Part 1 and Part 2, or Part 1 and workplace-based assessment and got through both. and then they are eligible to get the AMC certificate. Once you get the AMC certificate, you actually have to do some hospital rotations. I'll come back to that. With those hospital rotations, you get a full registration capability or eligibility with APRA. So in the, like, I don't want to drag this video for long, but I was trying to sort of give you a sort of overview of how to sort of come into Australia and work here. To come into Australia, you should at least have done the AMC Part 1. Obviously, you have to show your English with the IELTS or OET or PTE, one of those exams. And once you got your AMC Part 1 and English qualifications, you can look for jobs in hospitals. So if you successful in getting a job in hospital, in my next few videos, I'll tell you all these things in separate videos, but I'm just giving you like an overall picture. So once you get a hospital job, you have to cover minimum requirement of APRA to get the full registration. What's the minimum requirement involved? You at least need to do 1 year of rotations, of hospital rotations, 3 months each. This should cover emergency medicine, surgery, medicine, pediatrics. So you need 3 months of emergency, 3 months of surgery, 3 months of medicine, and 3 months of pediatrics. People come here and join emergency department, get lucky in a way, like if you work in an emergency department for 6 months or more, say if you work in an emergency department for 6 months or more, APRA recognized that within a 6 months of emergency rotations, you cover the required pediatrics as well as surgery. That's what they interpret it as. Like, so if you do 6 months or 9 months or 1 year of emergency rotation, then you will get your emergency covered, pediatrics covered, and surgery covered. Then you only have to do your medicine rotation to get the eligibility for full registration. Once you apply to APRA with AMC certificate and those rotations, you will get the full registration with APRA, which gives you opportunity to go and join specialist pathway, for instance, GP pathway or physician training pathway or surgery training pathway or anything. And that also gives you the eligibility to do locums and then apply for other jobs. I think I should stop the video here because this is my first ever video, and then I wanted to see what your response is. After this video, I'll tell you the step-by-step AMC process. I will use the AMC website and I'll tell you how to navigate through AMC website and find all these things. For example, how to create your portfolio and what is Epic account and what are the exam components and how you find them, and what is workplace-based assessment and things like that. Okay, guys, I think it's enough for the day, and then we'll catch up with you in next week's video. Please keep watching and please keep sharing.